The last slide I have for you is the misinformation that you see out there. So I've heard the vaccine has a microchip. I don't know where that came from. I really, that's like from a Facebook post. Um, it doesn't have a microchip. That doesn't even make sense to me. But this is a real fear that people in my family have, people in our community might have. So when you hear that, my initial reaction is to cringe, but I think we have to listen and try to hear where it came from, go back to the source and express both empathy and then confidence in what we know about the vaccine, that there is not a microchip. There's the rumor that it's caused a bunch of deaths, and I know where that came from. So there are reports, first in Norway, uh, the Pfizer vaccine, after over 40,000 people had received that vaccine, they reported a cluster of 33 deaths in nursing home patients. Norway prioritized nursing home patients first. And so I think one of the things that you see there is that these were elderly patients, many terminally ill, and that early death after the vaccine was ruled to be likely natural causes. The same thing was reported in Germany. There were 7 older adults who died shortly after vaccination, after 800,000 people were vaccinated. So the World Health Organization took this to heart and did a deep dive into the epidemiology here. They found that the all-cause mortality rate in those patients with their underlying conditions and age was no different than what would be expected of the normal population. And on top of that, for those of us who do care for elderly populations, on balance, the risk benefit is still favorable in terms of getting the vaccine to those people. Another rumor is that it causes infertility. And it took me a while to figure out where that came from. But there's a German epidemiologist who has a history of vaccine skepticism, which, okay. And he petitioned the European Medicines Agency to delay approval of the Pfizer vaccine because there's a protein in the Pfizer vaccine that is also in the placenta, or at least shares some structural components. Their argument is that if we had antibodies to the vaccine, or for the vaccine, so antibodies to that protein, would we not have antibodies to a placenta and cause infertility? There's not a lot, that doesn't make sense for people who actually do this work, but anti-vaccination blogs and Facebook really, really let that take off. So because of the worry about that, the CDC and other agencies are doing enhanced monitoring of fertility and pregnancy in those who are vaccinated, but there's zero evidence to actually support that this would happen. The other thing that I think is interesting is Amazon Prime had a TV show, Utopia, that at the same time this is happening in our real world, this TV show had a vaccine storyline of using vaccines for population control. Very sinister and dystopian.